Hey guys, Dr. Justin Marcagiani here with Garrett Salpeter. Really excited to have Garrett back on the show. Garrett's a regular here. Again, Garrett's in Austin, Texas, and he has his clinic called the NewFit. He has a bioelectric biohacking healing device called the Newbie, something that I've used in my clinic for years. Very passionate about it because it helps accelerate inflammation reduction, healing, human performance. And we're going to just kind of talk about injuries, performance, range of motion, just the whole 9 yards, because Garrett is an expert in physical medicine. So really excited to have Garrett on the show. Garrett, what's up, man? How you been?
Thank you so much for having me on. It's great to be back on here, get to catch up with you, and excited to dive in.
Awesome, man. Well, you're always doing a lot of research. You're on the cutting edge of what you do because you're producing technological devices. You're doing continuing education. You're doing research. So you're always kind of have your finger to the wind. What's working best? What's happening kind of in your clinic with some of the research on with using the Newbie, which is a bioelectric device? And why don't we just give people a little summary of what it is and just talk about what you're seeing in your practice?
Yeah, absolutely. So the Newbie stands for Neurobioelectric, and it's a direct current stimulation device. So if people have experience with electrical devices, virtually all of them are alternating current. This is direct current, and that's important for a couple reasons. The first is that the direct current electric field actually creates this electric gradient that can help orient or align and accelerate the function of the cells that control healing of bone, muscle, connective tissue. So if we have a physical injury, direct current can actually speed up the healing process. And sometimes, even more interestingly, the second kind of benefit of direct current is the effect that it has on the nervous system, because we often have people who will come into our office, in pain or with limited range of motion, and in one session they'll notice tangible, significant improvements. And there, in the span of one session, you might be doing only 10 minutes of actual treatment, and it's
Hmm.
obviously far too short of a period of time for any meaningful tissue healing to happen, right? Ligaments aren't regenerating in
No.
10 minutes, right? It takes time to heal. So when we see these changes, though, they're more functional, more neurological, working more on the software of the body instead of just focusing on the
Hmm.
hardware. And when we see those changes, that the nervous system is the software, of the body, and that's what controls pain, strength, range of motion, movement, and also thoughts and hormones and digestion, all these things, right? So the nervous system is super important. But when we see these changes, when people have pain or spasms or limited range of motion, being able to make these functional changes in the nervous system are super important. And direct current allows us to bypass a lot of the protective muscle contractions and speak more powerfully and more precisely to the nervous system, so we can make these changes more quickly and lead to longer, more significant changes in the long term over time.
Got it. So in summary, you have hardware, which is like bone, connective tissue, ligaments, tendons. Some of those regenerate faster, like muscle. Some, like tendons, ligaments, cartilage, take longer. Right. Either way, with some of the electrical healing modalities, you can still increase blood flow, drive better circulation, and then of course decrease inflammation. So that does accelerate healing on one side of the fence. And then we kind of have the software upgrade where you're really helping the nervous system to recruit other muscles around that area, which then now can buffer the impact and force. And then also, like we were talking about before the show, I had a spasm from a deadlift like a month and a half ago, and my body, I just could not get rid. I had to use a little bit of aspirin because it was just kind of buckled me over 45 degrees, and I just walking around like I'm bent over. And I took my Nubie and I just kind of got it into that area, and I just did 5 minutes of exercising and loosening, and it broke the spasm like that, and it stayed for days. I did another movement pattern the next day, and I was good. So it was just crazy that even though this is what I do, you forget how impactful just something like a few minutes can be when you're in that much pain.
Yeah, and the thing about that and why it's so beneficial is that you're really getting to the root cause of the problem there, which in that case, it's very common for people who, quote unquote, throw their back out. You bend down to pick up a pen or something, and something seemingly innocuous can cause this reaction where the back, just is incredibly painful, it gets into spasm, and people think, oh my gosh, there must be some sort of structural issue. But in most of those cases, there's a minor irritation of the spinal cord or a nerve root. And then what really causes the pain is the body's reaction to it. It's not so much about what happens to us as it is about how we respond
The
to it.
guarding.
And yeah, so the body creates this hypersensitive spasm guarding state. and really tries to lock down that area to make sure you don't irritate that nerve again. And it's the spasming, it's the reaction that actually ends up creating the worst of the pain and limitation. And so with the device and this use of direct current having this effect on the nervous system, we're able to go map around, scan around on the body to identify where that hypersensitivity or that protective mechanism is being imposed on the body, neurologically speaking, being imposed on the body. And then by stimulating that area, it essentially creates a lot of feedback to the brain in a way that teaches the brain that it's okay to actually move that area again. It allows the brain to break or down regulate or decrease that protective spasm. It's like if you have a child who's screaming and you can soothe them either by holding them or giving them a treat or a pacifier or something. It's sort of
Right.
like that sort of thing.
Yeah, because I had my wife literally doing my percussor on me. I had her doing some soft tissue. I saw my massage person. I couldn't even do chiropractic outside of blocking because the spasm was just too tight. But just 5 minutes on that was enough to kind of reset that software. And so when you're like dealing with someone like that, where would stretching come in? Because I felt like stretching was actually making this problem actually worse. How would you incorporate that into someone's program, or like if someone's injured, how would that kind of come factored in?
So when we talk about stretching, I think it's really important to look through the lens of this software versus hardware
Yeah,
conversation, because when we stretch, a lot of times we think that we can literally like pull our muscles apart and make them physically longer, but
right.
what we really want to do, like that based on the image that a lot of us have of how the body works, that sounds promising, but what we you can lengthen connective tissue over time, but that takes a long time to remodel. What we really want to do to increase flexibility is relax the muscle, is to change the tone or tension, and that is 100% controlled neurologically. So what we really want to do, if we're talking about stretching to increase muscle length or increase range of motion, what we really want to do is change nervous system signal or tone to relax that muscle so that it can accommodate greater ranges of motion. And there, because it's a neurological skill, you really need a neurological input to make that happen. So using the newbie or using other techniques where you are, instead of just kind of stretching and relaxing there, if you're adding in some breathing and you're waiting long enough for the nervous system to relax, there can be some benefits there. Or if you're contracting the opposing muscles, some of that is, some of that can make an impact. But in terms of sorry, there's a alarm going off over there.
No worries.
Uh, I think it's a smoke alarm from someone making my wife making breakfast. So the the nervous system signal really is paramount, and so finding ways to address that are so important. And that's one of the benefits we notice using the newbie, is that we often can help people not only break that spasm and guarding to reduce pain, but also see increases in range of motion pretty quickly, because we can send that signal there to teach the brain and nervous system that can allow that muscle to relax, allow it to go through greater ranges of motion, and open that up. And then there's an interesting question of, okay, if you open up this new range of motion, then can you control it? Because if you go into a new range of motion, if you could only get your arm up to here and now it's getting up to here, but you don't have any control up here, you're then at risk of injury also there. So then you have to be able to create strength and motor control and coordination in those new ranges of motion. And again, those are neurological skills. And so using a tool like the newbie can be very beneficial there, as can isometrics at the extreme joint angle, where you really get to focus on muscle recruitment over a period of time. And strength training through complete ranges of motion can be helpful. Some of these more traditional approaches, as long as you apply them in the right way, and it really helps to keep this software and hardware framework in mind. But that's the main thing, is that we want to think about stretching more from the software side than the hardware side.
Yeah, I always found that foam rolling was really helpful, and just doing a full range of motion of whatever that was, whether it was a squat or a lunge, whatever that was. So a lunge, for instance, to work on my hip flexor, just going into that for a couple of seconds and coming out. I felt like doing something more dynamic was always helpful, because in life you're typically not holding a move for 20 or 30 seconds. I also found doing that with like the newbie on my hip flexor and lower back, and then going into that lunge for a couple of seconds, I felt like just kind of getting it up to first sensation was very effective as well from a stretching standpoint.
I would agree with that. And from my perspective, at least, I think a lot of people in stretching are kind of in this no man's land. You know, they do
Yeah,
maybe like a 20-second stretch where you're better off doing like you did either of the extremes. So like you did, go into it in and out, like doing movements where you're just holding maybe a couple seconds at that end range.
right.
So shorter time, but more repetitions, or longer, being in a stretch for 2 or 3 minutes, so that you give the brain time to understand, okay, it's not as threatening. We're safe enough here to be able to let go and reduce tension.
Right.
So a lot of people are in that kind of no man's land middle range where it's not as effective as either the shorter ones or the much longer ones.
That's great. And then so when you have people that have pain because a disc is bulging out or herniating out and hitting that nerve at the IVF or at the disc level, what are you doing kind of with your techniques to kind of help reduce that disc pain? Because conventional medicine, I mean, outside of doing surgery, I mean, maybe you do some kind of decompression or, you hang upside down or there's some different like decompression techniques or tables that chiropractors use. What do you typically do in your clinic when you see a disc patient?
So one of the first things that we want to start with is actually education. Start with talking about some of these really fascinating studies that show, for example, patients who have herniated discs and back pain. If there's one group that has surgery, another group that uses physical therapy or chiropractic or more conservative care, and after 12 months, they end up virtually the same. So there's really very little long-term benefit, and not to say that there are cases where surgery is not required or something like that. I think it's overprescribed and overdone, but there certainly are cases where it's the right move and it's worth doing. Um, the other thing that we like to share with people in this kind of educational process is that there are really fascinating imaging studies that show something like 30% of people in their 30s, 50% of people in their 50s, and even higher the older you get, have people who don't have any pain at all. Half or more of them will still have some disc bulges or some herniations or different things show up on an MRI that normally you think, oh, that would cause pain, and yet they don't have any pain. So the question is, why can someone else have the same thing you do and have no pain, and yet you are coming here to see us in pain? There's more to it than just the structural issue. So a lot of it has to do with that same protective spasm that you had when you were talking about you deadlifted and then you got that
Yeah.
that spasm in your low back. So a lot of it has to do with that kind of pattern, the individual getting stuck in that pattern over time and not being able to break that cycle of spasm and pain neurologically. So the first thing that we want to do is go through that same mapping process, identify where the guarding and protection is happening neurologically, and do that same process. And sometimes we notice people make significant progress, even though again they're in one session their structure hasn't changed, the disc hasn't healed or significantly moved back into place or anything like that. But a lot of times someone will feel better even in that first visit because they've reduced that spasm. And then we also want over time to help better balance the structure, get the right muscles working so they're no longer collapsing into that part of the spine and causing the pressure on the disc that's going to make it bulge or herniate. So we also want to, even if someone's feeling a little bit better right away, we want to make sure that we continue to work on proper muscle activation, improve biomechanics, so that they can then do more and more activity. They can increase the load on their body, be more active, and have the resilience to be able to do that without slipping back into that that kind of painful spasm guarding protective state.
Yeah, I think that's solid because when you have an injury, right, you talked about kind of the study on the x-rays where they looked at x-rays or MRIs and they saw 50% of people that had bulge or issues that should cause pain had no pain, right? So there's something functionally at play here where you look at the structure objectively, obviously flip a coin, someone could be in pain or not, but then functionally something else is going on here. And you kind of alluded to it earlier with the shoulder, increasing range of motion at the shoulder. You may have higher range of motion here, but you may not have the stability within your supraspinatus, your pec major, your pec minor, your subscap to be able to stabilize that muscle up here. So even if you were to injure, let's say your AC joint, right, acromion clavicular joint, right, the reason why would you injure that joint, right? It's because typically there's the muscles around that joint aren't stable. And so how are you looking at these joints and assessing Is this joint fully stable? How are we assessing the muscles all around it?
So I like to do manual muscle testing, and we teach a version of manual muscle testing for that, just to kind of check at a high level. Can this this patient, can this individual actually turn their muscles on in the first place? Can they actually get that signal there, or is there so much inhibition, or the is shut down, is the muscle shut down,
Yeah.
or weak because of bad habits or previous injuries? So we like to do manual muscle testing, just to see if there are any weak links, any areas where they can't turn on. And then we like to do the scanning and mapping process with the newbie that we were talking about, and that lets us know where's that guarding and protection is present, which also can mean inhibition or shutting down signal or
How does that
weakness.
work? Could you mind taking the machine and just, you don't have to put it on, but how would you scan that?
Yeah, so I don't think you can see that in my
Yeah,
frame
I'm
here,
gonna
but
have you go full screen.
we
Hold on.
got.
I'm gonna make you go big.
All right,
Let me see if I can make you big here. Just give me a sec.
sure.
See if I can get you bigger on this here. Okay, there you are. All right. Well, let me see if I can. Well, I'll have you keep on. Hold on. Let me turn me off.
Oh, there we go. Okay, so this is the device right here, the newbie, and what we would do is actually take one of the pads and scan around on the body like this. So we're scanning around, and what we're doing is actually sending the signal as if that area of the body is being loaded. So when it's on the bicep, it's as if you're doing bicep curls or using that muscle there. And wherever the muscles are working well, the brain sees that and says, oh yeah, that's just that muscle doing its thing normally. There's nothing threatening about that. But if we stimulate an area that hasn't been working well recently because it's been weak, or you have bad habits where you haven't been using that area, or have adjusted around it because of old injuries, if we stimulate an area like that, or where the brain is guarding and protecting in that area, then we have a situation where we send that signal, and the brain sees that and says, whoa, 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 that's threatening, that's different, that's novel or new. And so it'll protect against that. And so most areas that are working well feels kind of pleasant. And then when we get that greater reactivity, where we pick up on that hypersensitivity and some of those neurological issues that we were talking about, the body reacts more, and that helps us understand where we need to stimulate. And then we stimulate those areas, and we teach the brain to take off the brakes, so to speak. If it's guarding and protecting, it's sort of like you're driving a car, hitting the throttle and the brake pedal at the same time, which of course is inefficient and wastes energy. And so we teach, not necessarily teach you to like get stronger or put more force down on the throttle, but we teach you to be more skillful neurologically and take the other foot off the brake. And that's what this does. This helps us find the reactivity where those brakes are being imposed, and then lift them off to an appropriate level. We have protective mechanisms to prevent ourselves from getting hurt, and this just allows us to reset them back to the normal level, not to any place that's going to have us in a compromised position.
That makes sense. And then when you find you kind of scan, you find some issues, some disturbance, some may manifest as pain. Then you anchor one pad, and then you search on the through the other pad, right? And so when you're doing that, are you trying to cross the joint? Are you like, what's your philosophy when you scan? Is it just kind of looking at the next best area, or are you trying to go across the joint where maybe stability or anchoring would happen? How does that next step work?
So I'm trying to find the first domino, or the area of greatest impact. So when we find, if we have a spot here, on the pectoral muscle, for example, and then what we would do is, yeah, we'd figure out where to put the other pad, where to, the grounding pad or the source pad or whatever you want to call it, and we would then find the area that's gonna kind of maximize the impact here. Sometimes that spot itself might also be a hot spot or an area of greatest or greater need. And uh, we don't necessarily need to go across the joint, or more proximal and distal, or higher up and further down. It's more about finding the area of greatest need for that person neurologically, where they have the greatest amount of protection or inhibition or dysfunction, and working on that. So sometimes the pads will be, if I another one here I'd show you. Sometimes they'll be like right next to each other. Let's imagine this is a pad. Sometimes they'd be right next to each other. Sometimes they'll be across the joint like that. And then sometimes they'll be, oriented along, one lower down on the arm. So they can be in different orientations. There's not necessarily a set mechanism of, yeah, we're trying to go across the joint, or trying to have them both longitudinally along the same muscle. It's more about trying to find what is the area of greatest need for that individual person.
And how many outputs or pads would you put on that joint? Obviously, with the newbie, the cool thing is you have up to 8. I mean, for something as a shoulder, would you kind of keep it at 2 or 3? Bigger joints, you'd go more. Like, what's your philosophy on how many output, how many pads would you put on a joint in a given area?
It depends on where we are in the process. In the beginning, we're doing that mapping process. We're finding these hotspots or areas of interest or dysfunctions or trigger points. Sometimes we refer to them with different words, but we essentially want to let the patient's body be our guide in the beginning, and work on however many hotspots show up. And so for some people, it's two pad, there's one spot and we need a grounding pad or a source pad to stimulate that. So for some people, it's just two pads. And then for some, they have, 8 or more hotspots. So we might be using all 8 pads, even on a smaller joint, or smaller area of the body. So it's more about that, more about what's showing up, what that patient is presenting with, and what their body's telling us in the beginning. And then as we progress, once we get out of that acute stage where we've worked through those hot spots and those kind of more immediate, more acute dysfunctions, then we want to talk about improving mechanics, about strengthening, about increasing muscle recruitment, or relaxing muscles for greater range of motion. And then we can use, all 8 pads, depending on what we want to do. So one of my favorites, examples of this is to talk about the hip. If we want to increase hip extension, we can actually use a couple of the leads on the front side of the hip, on the hip flexors, quads, adductors, on a setting that's going to help them relax more and more and more. And then on the back side of the hip, so on the glute specifically, we're thinking there, to drive hip extension, we can actually change the setting on the device to create more contraction in those muscles. And so contraction on one side, on the back side, and relaxation on the front can help lead to greater hip extension range of motion. So it depends a little bit on where we're going. Definitely, in the beginning, we want to not necessarily work on a predetermined number of spots or pads, but let that patient's body be our guide.
So when you work up a patient, right, and you kind of like map out these hot spots, let's say someone comes in with a shoulder area, let's say you find some hot spots here and in the back and then down here on the tricep. Are those kind of your spots you're going to hit for the next couple of weeks, or are you trying to reinvent the wheel every time and then you're scanning every single appointment and seeing if they change? How often do you keep the original spots going for that first assessment?
So that's a great question. Most of the time, the fortunate answer for a clinician is that you typically don't have to rescan, because typically these patterns that people have that are contributing to injuries, are fairly deep seated or deep rooted patterns that are going to take a little while, take several sessions to fully, we should see progress each visit. And yet we should likely need a few visits to really make more lasting, even more significant and meaningful changes. So typically, once we find those spots, especially if they're standing out clearly and there's not a lot of them, typically we'd continue to work those same ones. If there's a lot of spots and we're having to prioritize, we may want to recheck those just to see. Sometimes when A or B improve, then we want to work on C, D, and E. Maybe those become the next kind of highest priority areas to work on. So it depends a little bit on the circumstances, but generally, you're not going to see significant change in terms of what shows up when we're doing that mapping session over session, unless someone, we definitely want to do it if someone isn't making the progress that we wish to see, or if there's a new presentation, a new symptom, or they went out and played in a basketball game or tennis match and have some sort of new symptom or problem. We'd want to rescan then. But generally speaking, you're picking up these patterns that are more than just like, oh, I slept wrong, or more than just, oh, that's just because my hamstrings are sore from the workout I did the other day. It's usually more, usually a layer deeper than that. And so when it shows up, we can work on it for at least several sessions.
I think that's great. I mean, as someone that worked in the physical medicine space for quite a while, I think this is an awesome tool to have. We'll put links down below. So if people on the patient level want to reach out to you, Garrett, and your staff, there'll be a link down below where they can reach out. If you're a practitioner and you or just someone who wants to access this technology at home for better health, kind of biohacking yourself more on a daily basis. We'll put some information down below for that. Anything else you want to leave the listeners with that's going on in your clinics? Anything new or cool that you want to highlight?
One piece of news is that we just in the last couple of months published our first peer-reviewed scientific journal article on the newbie,
Wow.
and it shows that we're basically using the newbie to without any weight, without any external load at all, and comparing that to the gold standard of exercise, which is lifting weights with about 75 or 80% of one rep max. So one rep max would be like the amount of weight that's so heavy you can only lift it once. 75 or 80% of that is, a weight that you could lift maybe 8 times or
Yep.
something like that. So
Hmm.
that's essentially the gold standard of resistance training, and we're seeing that with the newbie and no external load, you can get very similar effects on muscle as using heavier resistance and more traditional exercise. So that is something that is really cool because it opens up opportunities for people who can't lift heavy because they have a joint injury or some other pain or issue they're trying to work around, or they're in the middle of a professional sports season, and this can help them get training while better managing fatigue and stresses of the season. Also for older people or people who have mobility problems or various neurological diseases and dysfunctions that they can't really do traditional gym exercise weightlifting, this can allow them to get the metabolic, hormonal, muscle building benefits. And gosh, muscle, I mean, one of the most interesting bodies of research, I think, is shows the beneficial effects of muscle mass on longevity, and how having more muscle helps with so many factors, hormonally, metabolically, overall health wise. That maintaining muscle mass as we age is one of the biggest factors in all cause mortality and in extending
Yes.
lifespan and health span.
100% agree. I think that's awesome. Guys, to reach out, new.fit, neu.fit. We'll put links down below where you guys can reach out. We have some other content with Garrett. We'll put some old podcast links down below as well. Garrett, thanks so much for coming on the show. Really appreciate it.
Thank you. It was a blast. I loved it.
All right. Thanks. Take care.